A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, it's so lovely to see you, and I'm so happy to be able to welcome back Dr. Varsha M. Khurana. Varsha, welcome.
Hi there. I'm happy to be back here.
It's so lovely to see you, and I'm so excited today because we have decided that what we really need to be doing is answering your questions, answering the questions from our groups, from the people who follow Homeopathy 24/7, and the most important questions that we should be talking about all of the time. So I've pulled off some questions and Varsha's agreed to let's talk about them. Let's talk about what is happening here and let's open up to more questions. So just before we begin, can I invite you, if you have got a question that you would like answered on our Homeopathy 24/7 podcast, please do send them in to us. I will put my email down below. And we look forward to hearing from you. Okay, are you ready, Varsha?
Yes, I'm waiting for the questions now.
Okay, so our first question about homeopathy. I think this is such a brilliant question. Why is acute dosing more often than constitutional or chronic dosing when that is more spaced out?
Okay. All right. Should I go first, Mary?
Yes. You open up.
All right. So in an acute situation, normally, like let's say it's a fever or a cough or anything like that, the derangement that we are facing is it's a recent derangement, and we want to address it quickly because acutes tend to be very uncomfortable, and there's a lot of discomfort usually associated with any acute condition, I would say, and people want quick relief also. So we want to help the patient's vitality move a little quickly with the acute dosing. And that's why, let's say if there is pain, then we need to keep dosing repetitively at smaller intervals so that the pain abates and the patient can feel more comfortable, in a decent amount of time.
And let's just be clear about what we mean by acute or chronic, because acute generally are what, less than 2, 3, sometimes 4 weeks, but not generally longer than that, are they? So they're new symptoms that are just happening just now.
Yes. And chronics are any condition that has lasted for more than 4 weeks. I think we can safely label it as chronic.
As a chronic. So if acute is a new symptom, what you're saying is generally they're higher energy. They might be really painful. They're certainly sudden. They might be something that is really taking your attention right now.
Yes, and the system needs that support immediately. Let's say if there's an infection, then we need to take care of that infection and quickly. And we all know that with the right remedy, we are able to do that in quite short amount of time. Even if it's a severe infection, sometimes in the urine or sometimes a lung infection, we can fairly address it with the right remedy in a decent amount of time. So just with the right dosing, though, if we repeat it, if we try to influence the energy of the body at regular intervals, the results are just better. So that is why we the dosing for acutes is usually different
Yeah.
than the chronics.
So we're treating it in a completely different way because we're actually saying this symptom we need to help move on. We need to progress it. So in actual fact, then, let's just talk about what might happen after we've taken a remedy for an acute symptom, such as a fever, so that we can then understand why we're going to make that choice to dose again. So let's say, for instance, we have a fever and we decide that perhaps belladonna is a really good, well-indicated remedy. I think there are usually 4 things that might happen. 1, nothing happens. So what do?
We would want to change the remedy if nothing happens.
If nothing happens. So what we need to do then is go back and collect the symptoms again.
And analyze the case again, analyze the physical and mental state again, and evaluate the remedy and change the remedy. Maybe we were not taking the right remedy, because it's not always a quick fix or a specific remedy only for a fever. So we have to go back in there and look at it again.
Okay. All right. Now, if sometimes you might take the remedy and the symptom goes away and then it comes back again, what would we do then?
If the symptom had actually gone away, I would just repeat the dose at the same potency.
Okay, so that really is the answer to the question asked, isn't it? That's why we're dosing more often, because the symptoms having fast, it's gone away, it's come back, we can repeat the dose. And we might actually repeat the dose 2 or 3 times if that happens, to see if that remedy will hold. If it continues not to hold, we might possibly go up in potency.
Yes.
Okay. All right. So we've had nothing happens. We've had the symptom goes away and then comes back again. The symptom might go away and not come back. What do we do then?
At that time, we should be very happy with our prescription, and we should just celebrate and not repeat until the comfort, the sensation of comfort continues.
Okay, good. So if the symptom goes away, don't give any more remedies. That's fine. It's just wait and see what your body does. Remember that homeopathy is just acting as a catalyst for your own self-healing to take place. If it's healed, don't push it, don't kick it anymore. It's done its work. So as Varsha says, just celebrate it. So
yes, and you know what? When a person doesn't need too many repetition of the remedy doses, that means that the vitality was already in a good place.
Exactly. Yeah.
And it just needed a little nudge from our side, and then it's absolutely able to do its work optimally. I just want to mention one more thing here, Mary, if you allow me. So if there is a fever, and let's say there's a lot of discomfort associated with it, we give a remedy, and the response is that the fever stays the same, but the patient starts feeling comfortable in themselves. Then what will we do?
We wait.
Exactly. So we still wait, because the remedy is already acting, and the fever is only an outwardly sign of the vitality that the body is already fighting that state. We will wait more, we will let the fever take its course and just observe for that time.
Yeah, you're so right. And actually, that opens up the whole thing, doesn't it? That quite often when we give a homeopathic remedy, the first thing that happens is we feel different. That usually happens before the symptom changes, doesn't it? So it's almost like our mind changes first, or our emotion changes first, and then the symptom follows.
Yes, that's absolutely correct. And if I may say so, it is the correct way of healing as well.
Okay.
We do not want the fever to go away or just to suppress the fever. We do not want to do that, because we are trying to do it in the right way also.
Yes, yes, you're absolutely right. And also, I think this is a good time to mention, which I perhaps should have done in the first instance, that it is not always the case that in acute dosing we are prescribing more often. Sometimes we only need one remedy, and that's it.
Absolutely right. And also, if I may say so, there was a book I was reading earlier, and in many of our books, it has been mentioned that when the condition of acute leaves your body, in case it has been handled well and in the right way, it actually leaves you healthier than before.
Yes. Yes, we
So,
often see that, don't we, with chickenpox or a viral thing, when you see an absolute flare of vitality after
yes.
an illness.
Yes. So we should not always think that, okay, this is a fever, it'll leave me weaker. No, it's not going to do that. If it is handled well and not suppressed, then it actually might leave you healthier.
And in fact, that makes complete sense, doesn't it? Because we are building our immunity whilst we're doing
Exactly.
it, whilst we're healing. That is what healing is. It's using our immunity.
Exactly.
Okay, so there was one more aspect with that reaction that we might have had from our first dose of a remedy, and that is the symptom goes away, but a new symptom appears, or the symptom changes. What do we do then?
We will just have to evaluate the follow-up remedy for that condition then.
So we go back and retake all of those symptoms,
Yes.
collect all the
Yes.
details, and decide again what the body's saying and which remedy does it need now.
Absolutely. We just cannot decide right at the beginning of the acute that what's going to happen.
No.
We ourselves do not know what's going to happen.
We don't. We might get to know our own bodies, but certainly we can't prejudge somebody else's body, can we?
Exactly.
So let's go on then and talk about how that is different from constitutional or chronic prescribing, because we do that in such a different way, don't we? Because although we're looking at the symptoms, we're looking at symptoms that might have been going on for a few years that you are generally used to. They're not generally high energy. You might have flares of real high energy acute flares of the chronic, but it might be, for instance, your rheumatoid arthritis in your hands. It's something that is ongoing. What we do quickly, so does it make sense that the healing is going to be generally slower because it's taken a long time to get to where we are now?
It's a difficult question to answer because somehow every case presents differently and even heals at a different pace.
Yeah.
There have been times when in a chronic state, I was thinking it'll take me at least 6 months, it'll take me at least 8 months to, get to a substantial improvement. But some cases, they tend to, just after the use of remedies, they get better quite quickly. And some of them take even longer.
Yeah.
So it is never possible for us to just give an exact time of recovery to chronic patients because everybody's body reacts, in a different way.
You're absolutely right. And it is worth saying here that sometimes we have really chronic cases that we give one remedy and we have a beautiful result from that.
Yes.
And the body restructures, rebalances, and goes on its way and is absolutely fine.
Yes. Yes. But again, it's very difficult to say because I always, feel that sometimes patients expect you to tell them exactly how much time will it take.
Yes.
But I'm always boggled by that question because even after, treating patients for so long now, I am unable to answer that question.
Yes, I think you're right as well, because of course, I quite often say, how will you know when you're well? What will be different? And it's usually something that they want to do, or something that they want to achieve, or something that they're not able to do right now. And quite often I find that clients will come to us because of one particular issue. And after a month, 2 months, 3 months, maybe 4 or 5 months, that particular issue is much, much better. But they say, can you help with this now? Can we do this? Can we carry on? Because we're not just healthy and not healthy, are we? There's a long line where we can be in between. And once we've got the energy for healing, well, how good can we get?
Exactly. The optimization, basically, what extent of optimization of health can we take the patient to? That is the question.
Yes, yeah. Lovely answer. Lovely answer. Fantastic. That was a good question, wasn't
I think so.
it?
I'm sure we have plenty here.
All right, let's do another question now, completely different. It's about cell salts. I started taking a cell salt combination for anemia and rheumatism. They were all 3x except Natmure, which was 6x. I took them on and off for 4 months. However, I started getting a shoulder issue, which slowly developed into frozen shoulder. Do you think I've proved these remedies? So let's just, before we answer that, let's just go through what approving is, just in case we have listeners here that haven't experienced or haven't read about how we prove our remedies.
Yes. So proving is basically that you start exhibiting the very symptoms that you started to treat. And if the remedy is similar enough, and if you have overdosed to that extent, or if your sensitivity is matching to the remedy to that extent, then some people can go into provings. But it's not a very common experience.
It's not, you're right. But it's worth saying that our remedies are not tested on animals. They are tested on people. They are tested on well people who monitor everything, emotional state and physical state, whilst taking the remedy completely blind, without knowing what the remedy is, without knowing what the potency is, and anything else. And they are very, very structured examination of the remedies. And what comes out of the reports makes our materia medica. So our materia medica, our books which hold all the information of the remedies, have all of the information from the provings, as well as quite a lot of information from people using the remedies afterwards and the homeopaths recording the remedies. So what this person was actually asking is, I've been taking these remedies for a long period of time, and now I've got a frozen shoulder. What's that all about? So there's quite a few different elements to this question, aren't there? First of all, can you just explain for us what a cell salt is, please?
A cell salt is absolutely different than a potentized remedy, first of all, because a cell salt is working on the tissue or the biochemical level in the body and not at the level of the energy of the body. So that is the main difference between using a cell salt and using a potentized remedy. Now, about this question, I don't think I've ever heard anyone prove a cell salt.
No, I agree. And people would tend to take cell salts, and they're sometimes called tissue salts because of just exactly as Varsha said, because they're taken from every element that's in your salts. They are very, very, very low potency, almost herbal, really, aren't they? And so you can take them for longer periods of time, but for a new symptom to come up, I would say this is not approving. Would you agree?
It's highly unlikely from the use of tissue salts.
Mhm.
Because, tissue salts are basically used at the level of the deficiencies in the body, that what is needed in the body, which salt. So these tissue salts, the 12 tissue salts that we have, they are basically made from the 12, different salts that are already existing in our body. Now, these are supposed to just help you with if there is a deficiency or if there is an excess anywhere in
Exactly.
the body.
So it's the same remedy, whether it's a deficiency or an excess. So therefore, it's just balancing. It's not going to create more or have your body absorb more than your body actually needs. It's just a balancing remedy. So what do we need to do here? We need to find out a lot more about this frozen shoulder, don't we?
Yes, I think it could be a completely different issue coming up, or maybe the arthritis itself is progressing, and maybe a deeper acting remedy is needed,
Yeah.
after a case evaluation. Because as great as these cell salts are, I use them so commonly in my practice as well. But uh, a deeper acting remedy, and then if you add a cell salt along with that,
Yeah.
that's what we want to do, and not just use the tissue salt, because we are not addressing the deeper afflictions that are usually manifesting with a condition like arthritis or a chronic anemia, so to speak. You
Uh-huh.
still need a deeper remedy. A ferrum phos taken in a tissue salt will effectively support your system, but at the same time, you need a potentized remedy as well.
Yeah, absolutely. So what we're saying is we need to go in at a deeper level here. And let's face it, anemia and rheumatism, they are chronic
Yes.
symptoms, aren't they? They are long-standing symptoms, and you will be experiencing them very, very differently than the next person. And
Of
so
course.
we would say, it is more than likely that we need a different remedy here. We need a homeopathic remedy that's really going in and addressing the cause of why your body has got the rheumatism that it's got, and why your body is anemic. And also, we might therefore be asking questions about diet, about intake of certain foods. Certainly, we'll go through the health history to find out what has happened before.
Yes, because arthritis is usually a familial disease, usually a familial disease. So we really need to go in there and address that familial predisposition with a chronic remedy, with a deep acting remedy, matching the entire state of the person mentally and physically. And only then can we expect some kind of deep healing.
Okay. Really, really good answer, Varsha. Thank you. And whilst we're before we move on, let's just address the issue. What should we do if we have had a proving, if we have proved a remedy? What can we do? What do we do?
First of all, stop
Stop the
this tissue
remedy.
salt right away
Yes.
and just wait for a while to see how the body handles that.
Yes.
And then, if the symptoms are still persisting, then we will need to evaluate the case accordingly.
Perfect. So I hope that just answers any questions that came up with that. Do you think we've got time for one more question?
Absolutely. Let's go.
Okay, this actually runs on very, very well. I'm wondering if it's okay to take a remedy for a prolonged period of time. I have a tooth infection and I'm waiting for an appointment to have it removed under sedation. I've been waiting a few months already, and I've been using Hepasolf and silica. Then I stopped taking it, but I need to restart taking it. Can I continue like this?
I'm sorry, my dear lady, but I would like to know which potency were you using? That is very, very important. I would not want to repeat a Heeper-Sulf in a 30 potency also for weeks altogether, because I
Yeah.
don't want to do that. It's not really the right thing to do. If you were probably taking it in a very low potency, then maybe you can take it for 2 weeks and then evaluate the situation again.
So certainly we would be saying you mustn't be taking it every day, or some people are even taking them twice a day for long periods of time. The remedies either work and they change things, or it's the wrong remedy.
Absolutely. I'm not a fan of taking a remedy for a long period of time.
Okay, so if it hasn't healed what the problem is, then we need to do something else. We need to look
Yes.
into. So if the symptoms are getting better and then getting worse again, if we have repeated that over more than a week, then we need to relook at it and see if there's anything better that we can be doing.
Yes, absolutely. I was just looking at teeth pain or teeth decay, and we have hundreds of remedies.
Yes.
It's great that you know about Heeper-Sulf and silica, because they are, commonly indicated remedies for such conditions, and people use them. But at the same time, we have too many other remedies. And
have.
if we do not know the specifics, if you do not know the specifics of your case, it's quite likely that your infection will not, be helped effectively by these remedies.
So let's just go over some of the questions we should be asking in order for people to understand how we would find the right remedy. So with a tooth infection, there are lots of questions that we could be asking, aren't there?
There are too many questions associated with that. Yes, which teeth is affected? First thing, the
Yeah,
location of the problem, right?
yeah,
Then I'm just outlining the
yes,
three of the main things here. Not can't go into that much detail, but still. So the location of the problem is one thing that we would want to know. Then we would want to know what is the sensation of pain or discomfort that you're getting during this state. And then the third thing would be what makes it better, what makes it worse. There are people who sometimes when we ask this question, they take minutes to think that, what is making it better or what is making it worse, because they probably they're not feeling those things consciously or too strongly, and they actually have to think about those questions before answering them. And in some cases, in some infections, there could be an associated symptom that started along with the teeth trouble. Is there anything like that you're facing? So these are the main things that we would like to know. But I'm afraid there are many other things that could come into discussion once we start there.
yes, exactly. And once we're talking about the actual the physical, what's happening there, what can you see, what can you feel, what can you taste, what can you smell, all of those aspects would lead to different remedies, wouldn't they?
Yes, and what is your reaction to pain?
Yes.
Are
Yeah.
you scared of this condition? What are you feeling mentally? Everything. We need to be going there if there is an active tooth infection also. It might sound that, it's too much, but in homeopathy, that's the only way to go.
That's right. That's right. And so really it doesn't matter if it's an acute symptom or a chronic symptom. We are going to get as much information as we possibly can in order to find the right remedy, because there is no point giving the wrong remedy. I can understand that if you only have 30 remedies, we need to start with one of those remedies until you get something else in. And that's really important to do. And I know that all of the time with the apps and the books and the ebooks and the webinars, we are mentioning the most common remedies that you might have in your first aid kit. But we must keep reminding everybody that we have taken maybe 6 or 7 remedies from a list of 100 or 200 or
Yes.
300. So there are still lots more in our cupboard, effectively, that might be particular to you. So learn by
So,
this experience, learn by collecting the symptoms, learn by putting it all together, and learn which symptoms are helpful for you. Because if you have particular symptoms that really help you, it's likely that you might need that remedy again sometime.
yes, I think so, because there are many people who experience their acutes in a certain way repeatedly. So, yes, it can be very helpful, and sometimes the same remedy is indicated if it's the same acute condition occurring in the same patient. But there are many instances where we need to change the remedy even in the same patient.
Yes.
So, it's really not, it's very variable. It needs to be seen for that particular incident as to what is happening currently.
So each time there is something different, we need to retake the case. And by the words retake the case, we mean collect at least 5 symptoms, don't we? We need
Yes.
to know the locality, we need to know the sensation, we need to know the modalities, that's what makes it better or worse. We need to know the extension, what else is happening, concomitants.
Yes.
We need to know all of that information in order to pick a remedy.
Yes. And even with that, sometimes we are, stumped by top 3 remedies, and we have to then again go into the materia medica and read them and then try to match the case.
Yes.
So it is exhaustive. It takes time. It's not something like we cannot just say that, okay, Heber salt for teeth infection. It won't work like that in every case. I really hope that the commonest of remedies help you. But if they are not helping you, then taking it for, weeks is not the answer at all.
You're right. You're right. Varsha, it's been so lovely to do this. It's really worked well, hasn't it?
Yeah, it's lovely to chat with you, Mary, always.
And I think this is really going to help people understand the little things that perhaps we don't get the opportunity to discuss when we're just writing blogs and writing ebooks and things. To have this conversation really brings it to life, I think.
Absolutely, because I think discussing about homeopathy and its application, it is very, very essential for people who are, just starting to use it, or even who have been using it for a while. It could get a little complicated. So it's good to discuss these things and put them out there for everyone to listen to.
You're absolutely right. And even as homeopaths, we still need reminding sometimes of the answers to these questions, don't we?
Absolutely. In fact, I would like to, mention there's a recent case I dealt with. It was supposed to be an acute case, and it came to me. It was a case of chorea. And the chorea, the tics, they had just started, like it was barely 2 weeks in. And it started when this girl got married. And immediately after marriage, it started. So I was just looking at it, what should I do in this case? It's very recent. I was not getting too many clues, etc. And then I found this rubric where it said chorea after sexual excitement, because she had just gotten married, and probably
Yes.
there was that factor was important. And there was only one remedy. It was platina that was mentioned, and the remedy worked a charm. I didn't have to do everything or get all the symptoms because it was characteristic for that case. But then that's what I'm saying. Every case tells us where to go or what to do. And sometimes even we have to look for things in a particular case before we can get to a remedy.
You're absolutely right. Yes. And as you have said again and again, everybody's different. We're going to be addressing it in a different way, but we go where the energy is, don't we?
Yes, where the current energy is coming from, that's where we need to understand, and that's where what we need to evaluate as well.
Perfect. Perfect. Dr. Varsha, shall we do this again sometime?
I would love that. And soon.
It's been lovely to talk to you. Thank you so much.
Thank you, Mary. Thank you for having me here. Thanks.
Thank you so much, Varsha, for coming on and answering these questions. I think this is going to be such an enjoyable way to help people learn more about homeopathy and learn how homeopathy can be interacted with their life and everything else that they're doing. These are the questions that you are asking. These are the questions that you need to know the answers to in order to learn more about homeopathy. And with that in mind, next week I will be discussing with you a few different ways of prescribing homeopathic remedies in the form of your own medicines. So I'll be discussing that with Hector Ross, and I really look forward to welcoming you and having this conversation with you next week. Take care. I do hope you've enjoyed these episodes, and I do hope you can subscribe to our channels. Now, there are various ways for you to listen to our podcast or watch it on video on YouTube. So whether it's iTunes, Spotify, or YouTube, please do subscribe and please do leave us a review. If you leave us a review on these platforms, then more people will see our podcast. We just want more people to share the joy of homeopathy. It's a choice that everybody should know about. Please do everything you can to help us help more people.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.